Hey, what's up YouTube? Today is June 11th, 2020, and we're back with a new YouTube video. Today we're going to be talking about how to filter good back pain advice from bad back pain advice. But before we jump into this video, as most of you know, or for those that watched my last video, you would know that I invested in a new microphone. And the new microphone has actually two mics. One is on the wireless transmitter here, and the other one is the microphone that is attached to my shirt here and actually plugs into the transmitter. So through this video, I want you guys to listen carefully, and if you guys can, go back to my previous video and let me know if you guys notice any differences in the audio quality. I would really appreciate that. But anyways, let's jump into today's video, how to filter good advice from bad back pain advice. So when it comes to back pain, we need to understand that everyone's back pain is different. Not one person is going to be the exact same as another. If we can understand that, then we can start to filter through good and bad back pain advice. And what I mean by that now is when you see information online, we'll use that example first. If you go to a YouTube video, and if you're searching how to overcome low back pain, you may stumble upon maybe a trainer, therapist, or doctor that has a YouTube video titled 5 exercises to get rid of your back pain, 10 exercises or stretches to heal low back pain, or whatever the case may be. The problem then is that when someone goes to watch those videos, those exercises or stretches may apply to some people, but they may not apply to other people because everyone's back pain can be caused by a multitude of factors and everyone's symptoms are going to be different. And if you prescribe everyone the same exercises, you're treating them the same as if they had the exact same back issue. And why that occurs is because it's incompetence from the people putting out those videos and that information. But to use one additional example, let's use the example of clinicians, doctors, physical therapists, chiropractors, trainers. Let's use those examples here. So if you take somebody that has back pain, they develop back pain and they're going to get treatment. They want to overcome their back pain. So they book an appointment with maybe a chiropractor. Now the chiropractor comes in, maybe spends 5 minutes with them, 10 minutes with them on the assessment, and then pushes some sort of expensive traction device on them. Or let's use the example of a doctor where you have the patient coming in, they have back pain, the doctor prescribes them some pain relief medications, or maybe pushes some sort of injection, maybe PRP therapy or something along those lines. Or you could take the physical therapist, for example. Maybe they push just the McKenzie approach, McKenzie extensions on everybody. Or if you take a trainer, they may push some sort of exercise program or some sort of product for the individual. The point being, though, is all of this is a universal application in terms of the treatment and recovery or training for the person with back pain. And at best, it's a shotgun approach, and it's very simple thinking, and it's incompetence from all of these people. Now, I'm not saying this happens with everybody, but this is why a lot of people with back pain are failed by these clinicians or trainers. It's because that they were prescribed the wrong exercises, they were given improper treatment program, and the next thing you know, that person that was going through all these sessions, spent thousands of dollars, and they're only in a worse position now because these clinicians or trainers or therapists didn't take into consideration the individual factors. And why this would occur and why these people would do this is there's two reasons. Number one, incompetence. Incompetence from the clinicians, therapists, trainers, whether that's due to a lack of education, knowledge. Maybe they're unfamiliar with Stuart McGill, which is pretty common. or it could be just because they're lazy and they haven't done their research and haven't kept up with the research over the years. And maybe they just don't want to take the time to really put someone through a proper assessment. So that would be one reason. Second reason is there's also an incentive sometimes for these clinicians, therapists, trainers to push certain products or treatments on people with back pain. And one could be a specific traction device, a certain injection, medications. Maybe it's a certain lumbar support or exercise program. And the reason they would push this is because the incentive, maybe they get a certain kickback or they're getting more money from pushing these products or treatment plans on people, when really their success rate maybe isn't backed up by any evidence, or there's very little evidence, or maybe there's some evidence in a certain population, but they're just using a shotgun approach and applying it to everybody. So when you're filtering through bad advice and information like that, that's what you need to consider, is how are these people that you're working with or the information you're consuming online, is it universal? Are they not taking into consideration the individual aspects, and are they actually giving you a proper assessment, and is the assessment leading to a proper treatment program that's actually beneficial in getting you results? Those are the factors that you need to kind of filter through, and that should help you filter through the bad advice. But another thing to consider too is look at the testimonials, look at the reviews, do your research on these people. What's their knowledge and background and education? That'll also help you get a better idea of where this person's background is and what their success rate may be. When it comes to the good advice now, so that's the bad advice, which a lot of people watching this video have probably fell through that at some point, including myself. But now, moving into the good advice, I hope this points you guys into the right direction of how to approach making your selection on the information that you're going to consume, or with the clinician trainer that you want to work with. So the good advice is, number one, are they taking into consideration individual factors? Do they actually care about you? Do they want to actually work for you? Are they actually putting in the time? Are they being personal to you? Or is it just, are they being very short with you, not giving you that proper assessment like I mentioned? Also, what are the results? What are the reviews on these people? What is their success rate? Are they pushing certain products on you? So if they're not pushing products on you, probably a good thing. And what's overall, their education and background? Do they specialize with a certain injury, back pain? But the most important thing is just to consider is if they have an understanding that the individual itself needs to be treated or approached as the individual and not universally everyone has the same back pain and we're going to use the same treatment approach, then you're going into the right direction, and this is probably a person that would be worthwhile to invest in and work with. So that is just some advice when filtering through good advice and bad advice when it comes to low back pain specifically. And I hope this points you guys in the right direction about making the right decisions to help you overcome your low back pain. Because you do not want to be on the side of bad advice. You want to be on the side of good advice to make a quicker recovery and to pick the right clinician trainer that you want to work with, that is going to look out for your best interests at hand. So I hope this video gives you guys some insight, and that wraps it up for the video. And what is your guys' thoughts on the microphone here? So if you guys don't mind, go back to the other video, give me your thoughts. If one sounds better than the other, or if there's a difference, I would love to know that, because that will help decide how I'm going to shoot my videos here for the future. So anyways, any comments, questions, or if you even want to share a story about maybe going through bad advice, good advice, whatever it is, and maybe why you kind of maybe stumbled upon this YouTube channel or whatnot, I would love to hear that and have a discussion with you about that. Okay, guys, that's it. I wish you guys all a successful and productive day. Take care.